We have a need in the emergency department to have negative flow rooms, which are the safest types of rooms to take care of patients with possible coronavirus exposure. Essentially what it is there's a gradient between the outside of the room and the inside of the room, such that the pressure inside of the room is less, meaning that air from outside will flow in and air from inside the room will not flow out, which is really important because if you're trying to keep these respiratory isolation precautions, you do not want the air to flow out. And then the air that's in this room then gets exhausted outside into the environment, not back into the hospital. So by having these safer negative flows, you're able to control the safety of the environment and the respiratory isolation. When patients arrive to our emergency department, we cohort them relative to if they have fever and respiratory type symptoms, then we would get them preferentially in a room back here or in one of our other negative flow rooms in the front of the emergency department. Then we try to keep people that have maybe injuries and don't otherwise have infectious symptoms in a separate part of our emergency department. In the emergency department, prior to COVID-19, we just had 5 negative flow rooms. By bringing this unit on, our respiratory care unit, that used to be our observation unit, we now have 15 rooms. We are prepared, and we've used this time to really be as prepared as possible for what lays ahead.